and meet the healthcare needs of this community. Our mission and vision is first, to keep our community healthy, and secondly, to take care of people when they are ill or need other medical care. Our team has been met with unsurmountable challenges over the last 18 months, yet this team continues to show up strong and ready to care for others. I've said it before and I will repeat it. They are my heroes. Today, they need your help, we need your help, and we need it now. COVID cases are surging and our entire state is grappling with an unprecedented flood of very ill patients. Other non-COVID related medical needs and emergencies continue. We've experienced an alarming increase in COVID hospitalizations since July the 26th, with no sign of these numbers decreasing. Our ICU consistently remains at capacity. We have been holding COVID and non-COVID patients in the emergency department for extended periods of time, which can be days, due to lack of available ICU beds. If a patient requires a service that we do not provide, we may be unable to find a hospital that is able to accept the patient and transfer due to capacity issues across our state and neighboring states. Ambulances are also delayed because hospital patients are waiting on ambulance stretchers until there is an available bed in the emergency department. This is currently causing significant delays and extended wait times. Today, while we do have some medical beds available, we do not have the staff needed to care for more patients. COVID patients are taking up nearly 2/3, or nearly 70%, of our bed space, and that number keeps rising. Our hospitalized patients are younger and are becoming critical more quickly and requiring intensive care. The vast majority are unvaccinated. Caring for a COVID patient requires additional staff and supplies and is very resource intensive. Today, we are sounding the alarm to let our community know that this COVID-19 surge has reached a critical level due to the lack of bed availability and the staffing requirements this kind of volume creates. We need our community to know this is real and it impacts everyone. For the sake of our community, we are sending this message. If you can become vaccinated, don't delay. Consult with your trusted healthcare provider. Please do so today. I would like to now invite Robin Odom, Chief Nursing Officer, to give an update on our current numbers and our surge contingency plan. Robin.
Thanks, Janie. First, I want to start by saying how privileged I feel to have the opportunity as the Chief Nursing Officer here at West Calcasieu Hospital to lead our frontline caregivers every day. But I want to be totally honest. Our team, like all the other teams in this area, are tired. After nearly 18 months of fighting this pandemic, coupled with the other challenges our community has faced over the past year. So today, let me give you a glimpse of what we are looking at when we walked in the doors this morning. We had 35 COVID patients hospitalized, 12 of them in our ICU, which is our ICU capacity. 33 of the 35 are not vaccinated, which is 94% of the population. What we're seeing in this fourth surge is that this Delta variant is different. There's a substantial increase in cases in
blue ICU, code blue ICU, code blue ICU.
There's a substantial increase in cases among younger patients. The first surge appeared to have an average age in the upper 60s. The average age of our hospitalized patient today is 61. Data is showing that the majority of new cases are affecting the 18 to 40-year-old population. Over the last 2 weeks, we have experienced a sharp increase in hospitalizations. Today we are at capacity and are moving into our contingency plan. We have prepared an additional patient care area with 5 ICU-type overflow beds to accommodate patients that would otherwise be held in our emergency department. This is over and above what is normally required, but it is a measure that has been taken to accommodate more patients and to help keep our emergency department functioning as it should without being inundated with holding the patients. Sadly, too, we are experiencing the same staffing concerns that all hospitals in Southwest Louisiana and across the state are experiencing. Our patient care teams are working additional shifts to meet the demands, which includes shifting credentialed members of our nursing team into the frontline positions. We have been utilizing contract staffing for nursing positions. We are also working diligently to try and secure additional resources, including respiratory therapy, along with more nurses. Our leadership team meets daily, sometimes more often, to stay aware and to be updated and to plan for what our operations is requiring. Our situation feels bleak at times, but we never lose hope. I know our team will see us through this with the help of the community. And now I would like to introduce Dr. Kelly FUQUA. Thank you.
Thank you, Robin. Hello, my name is Dr. Kelly FUQUA. I thank you for letting me be here today. I have practiced as a family physician for 12 years in our town of Sulphur. As you have heard, our little community is at a critical point of this pandemic. This is not in a big town 1,000 miles from here. These are our neighbors, these are our families. In addition to the struggles of our inpatient team, which they are facing, we're also seeing high volumes of COVID-related care in the outpatient setting. Our most effective and valuable tool in this process is prevention, and vaccination is a crucial piece in prevention. I want to address 2 points that I've encountered in discussing this vaccine with my patients, as many of y'all may have these same concerns. Many patients have held off on becoming vaccinated as they wanted to make sure it was safe and effective. To date, over 4 billion doses have been given around the world, and that's a lot of powerful data and information speaking to the safety of this vaccine. Regarding effectiveness, we have now had the unfortunate opportunity to watch this vaccine work in a real-life crisis. The fact that over 90% of the patients fighting for their lives in this building right now due to COVID illness are unvaccinated patients supports how effective this vaccine is. It's also important to note hospitalizations and deaths are what we see discussed and what we talk about, but there are other endpoints that we see every day due to this virus. It's the 16-year-old student who had to sit out softball season last year because of lingering effects from their COVID infection. It's the 52-year-old normally healthy woman who suffered a pulmonary embolism 6 months ago due to her COVID and still can't walk up a flight of stairs. It's the 32-year-old single mom who 4 weeks later is still too wiped out to go to work or to enjoy playing with her children. And those matter to us. Those matter too. And those are 3 real-life cases from my practice. It's okay to change your mind. Even if you said 6 months ago, I'm never getting vaccinated. We know so much more now, and changing your mind does not mean you were wrong. It means you learned. So we encourage you to consider that. The second thing I would like to touch on is this is your opportunity to protect yourself and your family. Choosing vaccination does not mean you're endorsing any political party. It does not mean you agree with whatever's happening in Washington or Baton Rouge. Just like you could fundamentally disagree that there is a law mandating seatbelts, you can still wear your seatbelt every day to protect yourself. I can tell you the virus does not care who you vote for. As one of your local doctors, I do want to thank all of those who have reached out, who are praying for the efforts of your medical team, who are fighting the effects of this virus. And I ask you, if you want to help us further, to please consider preventing the severity of the next wave by considering vaccination. Thank you. I'd like to introduce Dr. Ashley Mullins, who is one of our inpatient hospitalists who's been caring for our patients here at CalChem Hospital.
As Dr. FUQUA said, I'm Dr. Mullins. I'm one of the hospitalists treating patients here in the hospital, and I'd like to share just a few of my experiences. The majority of the patients we have, as Robin said, in the hospital right now are here with COVID, approximately 70%. All of our patients, unfortunately, in the intensive care unit are suffering from COVID. Several of those are on ventilators. Overall, with this newer Delta wave and this fourth surge, we're seeing patients get very, very sick, and they're sicker at much younger ages than we saw previously, unfortunately. Despite our team working very hard and us doing everything we can, a lot of those patients we're not seeing improve like we would like to see them improve. So they tend to stay in the beds a little bit longer as we care for them and try to get them better each and every day. In addition, we have run out of beds in the ICU, so we have the patients in the ER, and we're doing our best to take care of them in the ER. We've tried several different medications. Of new studies have come out, working with our pulmonologist, Dr. Tari. We just haven't seen one yet that has been really effective that we've been able to treat and really get folks better with. We keep researching and studying and, trying our best, but we haven't seen a really effective medicine yet. What we've seen is that the patients that are coming in and getting critically ill are not vaccinated. Those are the sickest patients. The few that we've seen hospitalized that have been vaccinated have done pretty well and gotten out. So I urge you to talk to your physician and consider getting the vaccine so you can stay home and stay healthy and not be here hospitalized with this terrible illness. We're going to continue to do our best to treat everyone in this community, and we're going to continue to try to find new ways to treat them and take care of everyone as best we can, no matter where they're at, what setting in this hospital. We're going to continue to treat them. But we are at a capacity, and we're not sure where we're going to put them, and we're making new plans. But right now, we need folks to stay healthy and to stay home, and our best way to do that is to get them vaccinated. Continue wearing your mask a little bit longer, but consider getting your vaccine so you can stay healthy.
We also want to say to the patients who are currently hospitalized here with COVID-19 and to their families that we will not stop having hope for your recovery, and we will continue to give you our all. At this point, we will open it up to questions if you have some.
I have a question.
Yes.
You were talking about staffing shortages. Is the housing situation, also affecting that as well?
We can definitely say that the hurricanes, with all of the problems that have been brought about by the disasters that we have not only affected staffing. Our region has had people that have moved away. We do still have people who are struggling to get current housing. That definitely does affect the working population everywhere for all businesses, for sure. One of the other issues that we have is the hurricanes have decreased the availability of surge capacity that we have to add additional beds. Damages everywhere. We currently don't have a lot of space for additional surge capacity on a regular day, but there are other places in Lake Charles that possibly would have more surge capacity if it wasn't hurricane damaged.
You're talking about like physical space, like buildings?
Yes. Yes. Yes?
How is it just like the doctors being so spread thin, how has that affected other types of patients, like maybe who are coming in for cancer or anything like non-COVID related?
We're still doing our best to keep everyone cared for and safe, but the unfortunate thing is that folks who are coming in with other illnesses that may need, like Janie said, they may need a different treatment type setting, we're not able to get them there, unfortunately. So we're going to do our very best taking care of them where they're at, but sometimes we're not able to get them where they need to be. And like I said, again, we've also run out of beds because of the majority of our beds are taken up with COVID patients that we're caring for. So that's another issue that we're treating everyone the best we can as they come in, but it is problematic. So.
You want to go so far as to say to seek treatment at another facility?
Today, the alarm that we're sounding is that every facility in this state is in the same boat that we are, is my belief. So trying to go to a different facility, you're probably going to encounter the same problem. That is what we think our public does not understand. This hospital has always been very transparent with our community, and we will continue to communicate well. And this press conference, specifically today, is to sound the alarm with people. Social media has people saying that this is a hoax. It is not a hoax. It is real, and it is a problem everywhere, and not just in this state. Texas, Mississippi right now has some of the highest numbers for caseload. Any other questions? Yes?
Do you think with the booster shot that that's going to kind of help decrease the number of COVID patients that you're seeing?
Who would like to address that? One of our physicians or boosters?
I don't know.
I think our focus should be getting the majority of the population vaccinated with the first and the second vaccinations. That's what we really need right now, is to get a bigger number of our general population in this community, younger and older, vaccinated with the first two, if they so choose. And then at that point, I think it would be better to look at the third dose after we've gotten the majority of the people here vaccinated with those two.
One point that I'd like to make is that folks who are vaccinated tend to have a less severe case with the Delta variant. And so therefore, oftentimes, they don't require hospital care. But there's a certain number of them that will. The Delta variant is much more infective than the other types of COVID. And so we know just by the numbers game that those folks, we're going to have bigger numbers of sicker people. But generally, if a person's vaccinated and they do contract COVID, they're not going to be as ill and therefore not require as many medical resources. And that's why we're pleading with people in this community to consider getting vaccinated.
Your name, sir?
Ben Darby, I'm sorry, Ben Darby.
Obstetrics and gynecology. Any other questions? Thank you for your attendance here today, and I hope that you will help us send this message responsibly. Thank you.
Thank you.